All right, good evening. This is Greg Schmidt doing a cataract surgery at the Eye Surgery Center. I'm doing a left eye cataract with a PanOptix Pro multifocal PCIOL. When I do surgery, I sit superior. I first start off making a side port incision around the 2 o'clock position with my left hand. It's a 1.0 side port. Make the main incision about 10 o'clock. I use the 2.4 millimeter keratome. At this point, we've made incisions. I've done the capsulorhexis. I hydrodissect and pop up the lens. I use what's called a phaco flip technique. I go behind the lens with Helon to sort of elevate and lift the lens out of the capsule. Then I go in with a second instrument, which I call a sweep, phaco through the main wound, and I begin to break up the lens. I go in with a higher vacuum setting so I can grasp the lens and control it, crack the lens, and then I begin to break up and eat fragments in the anterior chamber. In this slide, I want to show you that I'm using a lower IOP. I used to use IOP of 65 and now at 50. I have fixed vacuum and fixed aspiration. It allows me to stay in the middle of the chamber, grab pieces, and just attack the lens. I find that with Unity, you really don't have to chase any pieces. They come straight to me. I operate really sort of in the iris plane. I'm not in the capsule, so I just kind of sit right in the middle and phaco. The next slide here is showing my low CDE. I find that the cornea is really pretty clear. Day number 1 in the post-op. CDE of 1.37 is lower, about half of what I used to have. But clinically, the patients are seeing better first day, and the cornea is clear. After that, I go in with the IA and I remove cortex, and I find that step pretty easy with the Unity, and I like to polish the lens, polish the capsule before I put the lens in. Here I'm putting the lens in. I like to use the auto injector, and I kind of go in a little more vertical, which allows me to seat the lens right in the capsule without having to manipulate it much, and that's shown right here. Injecting the lens, I filled the capsule lens with Helon or Provis. The lens slides right in, and then just kind of dial it in position. This is a toric multifocal, so I'll align it using the DMM. After this, we did a canaloplasty for this patient, but I just wanted to show you how I do cataract surgery with the Unity, and I find the new instrument great.